Hello, my name is Brian Casey, and we're here at RSNA 2014. We have with us today Dr. Larry Muroff. He is CEO of Imaging Consultants and a clinical professor at the University of Florida and the University of South Florida. Dr. Muroff, thanks for being with us today.
Delighted to be here, Brian.
Now, we had you here last year at RSNA 2013, and we talked about some of the trends going on in radiology. What sort of things have you seen transpire in the specialty since then?
Well, I think there are a few disturbing things and a few, I think, very exciting things. Obviously, reimbursement is continuing to decline, and groups are coping with that in different ways. The unfortunate way for many groups is to focus on increased productivity, and that has some negative consequences in that they lose or do not attend to the more important things, such as building relationships, serving on hospital committees, serving on practice committees, developing outside revenue sources, and in general make themselves far more vulnerable to lose their contracts. I think on the positive side, it's my impression that groups are starting, albeit slowly, to get back into the hiring mode. So I think the job market, in my view, is going to start to ease for residents and fellows that were concerned about the ability to get a job.
Now that's interesting that you say that, because on the many forums there has been quite a bit of pressure. People want pressure to be put on the Board of Radiology, American Board of Radiology, and the ACR to reduce the number of residency spots, and the ABR has been pretty resistant to do that. Do you think that's the right call?
Well, I don't know who controls. I don't know whether it's the ABR. I think it's the residency committee that does that. I think it would be a mistake to reduce the number of residency slots because, I mean, every common sense view of the future, whether it be alternative payment mechanisms or a mixture of fee-for-service and alternative payment mechanisms, bode for increased imaging. I think population's getting older. There are going to be rewards for decreasing unnecessary hospitalizations. There are going to be financial rewards for shortening necessary hospital stays, and imaging can play a major role in those two things, plus imaging will be necessary to deal with the older population. So I don't know any scenario that would show a decline in imaging. And if we reduce the number of residency slots, we may end up losing large chunks of turf because we're unable to handle the increasing load. So yes, I understand what residents and fellows are concerned about, which is not the number of slots, it's will I get a job?
Yeah.
Will I get a job that would be of my choosing where I want to work? But cutting the slots is not the answer.
What sort of advice would you have for a resident or a fellow who is about to enter the job market where things are looking kind of bleak?
Well, I think there are a variety of ways to maximize your chances of getting the job of your choosing. One is obviously an excellent training program. Two is a fellowship, but which I think now is almost mandatory with the new board requirements for 15 months before you can become certified. But don't take a fellowship based on what's in demand now, because by the time you finish your fellowship, other types of fellowship trained people might be in demand. So my major advice to residents are, yes, fellowships are now obligatory, but take them in the areas that you feel passionate about, because you're going to have to practice that for the next 35 years.
Yeah. Do what you love.
Do what you love.
All right. Great. Well, thanks for being with us today.
You're quite welcome.
Signing off for AmpMini.com, my name is Brian Casey.